My name is Harry Grin, and I'm going to be talking about benzodiazepines for my informative speech. So, how many of you know someone who is taking or has currently taken benzodiazepines, such as Xanax or Klonopin? Well, if I could see your hands right now, I'm sure at least a few of you would have hands raised. Because according to psychiatrist Dr. Musk, 12.6% of US adults take some form of benzodiazepine. Since that is about 1 in 8 people are taking here in the US a form of benzo, it is critical in understanding the effects this drug has on the brain. Today I'll be reviewing the work of peer-reviewed articles and accredited sources in order to convey these effects to you. Research into these effects of benzos has been going on for over 50 years, so we have very good knowledge and understanding into exactly how this changes our brain composition. So you're probably wondering now, what do these drugs treat? You might know someone who's taking it, but you might not know why they're taking it. Well, benzos are used to treat anxiety disorder, insomnia, seizures, alcohol withdrawal, and panic attacks. This is done so because it affects the neurons that play a role in stress and anxiety. In an article written by Dr. Joseph Notovich, he explains how benzodiazepines change neurotransmitters in the brain, specifically the neurotransmitter GABA or GABA. This is an inhibitory neurotransmitter. This works as a sort of tranquilizer on the brain. This then makes it harder for the messages to pass through. So if your brain's saying be anxious, it's not going through and you're not having that physiological reaction of being anxious. Think of this as like when you take a pain medicine. This medicine doesn't necessarily cure the problem, cure your broken leg, but it's going to make you feel a lot better and make it so those pain receptors don't get through. There are numerous types of these benzodiazepines too. The most common people have used being Xanax, Valium, diazepine, Klonopin, but there's many other forms across the world too. It's just a generic kind of class. And according to Dr. Notovich, different potencies and how quickly they are absorbed is changes dependent on the brand you're using. So Xanax is a quick, fast-releasing diazepine. Since this drug affects this body in this way, it must be prescribed by a physician. It's not an over-the-counter drug that you can just go and buy from your local Walmart. It is also important to note, since this is a tranquilizer, this should only be used for a short amount of time. Although this drug has these intended effects, there are also many unintended effects and side effects. According to mind.org, there's an extensive list of side effects. These range from less severe, such as headaches, to more severe, such as dizziness and suicidal thoughts. I like to think of it as one of those commercials you see on TV where they tell you all these great things this drug can do for you, and then they list 100 side effects, and at the end they say death with a huge smile. Although according to mind.org, uk.org.co.uk, these do not happen in everyone. This usually happens in young women and older individuals in general. That is why these drugs are considered paradoxical, because for one person it might help their anxiety, and for another person it could create tons and tons of problems. Mind.org.co.uk also stresses the importance of only using benzos for a short time. This means 2 to 4 weeks. Well, what happens if you do take benzos for more than 4 weeks? Symptoms get worse, ranging from feeling emotionless, those suicidal thoughts we talked about, to having bad memory problems, and eventually difficulty concentrating and long-term memory effects. Then after a while, you will need to take a higher dose to achieve the same level. In the medical community, we call that tolerance. It's the effect of your body is no longer getting the same effect from, let's say, 4 milligrams. So you have to go up to 5, 6, 7 milligrams. Once this tolerance does happen and you need to bump up doses, you're also going to begin to experience physical withdrawal symptoms that can stop you from being able to quit the drug immediately. The longer you take them, the more likely this is to happen and the harder it is to get off of them. So you need to make sure you're consulting a physician when you're on these drugs on a weekly basis. Since there are so many numerous side effects, there are many prescribing guidelines to help to ensure the participant is the consumer is safe. Guidelines written by benzoinfo.com state Benzodiazepines be used only for the short term of anxiety that is severe, disabling, or subjecting the individual to unacceptable distress, occurring alone or in association with insomnia or short-term psychoautomatic, organic, or psychotic illness. Sorry. These guidelines are not just here for the US, but these are across the world because we're seeing so many side effects. Although many of you know the healthcare system, especially here in the US, is by no means perfect. So, what happens when a clinician does prescribe for more than 4 weeks, or maybe they just had a legal use or an illicit use? Well, according to Benzo, you should start tapering the dose and work with a physician to make the best tapering plan. Tapering is the idea of slowly reducing the medication from 4 milligrams to 3.5 to 3, and to reduce the symptoms of withdrawal. If the tapering process is done too quickly, it can cause severe side effects like death and loss of memory completely. In conclusion, this drug is very powerful and must be used with caution. Harvard.Health.edu has recently had explanations into the effects of these drugs. Harvard.edu says the effects of these drugs we could be seeing worse and worse effects as we move on for decades. So it is important that you meet with a clinician, stay educated, and ask questions. Don't just take medicine because someone says it's good. Make sure you read up on your medication and be intelligent in what you're taking. Thank you so much, and stay educated.